Welcome to HICGI News Agency.
HICGI News Agency Live. Welcome.
Agency. HICGI News Agency. This is HICGI News Agency.
News Agency. This is HICGI News Agency.
News Agency live.
We are live. HICGI News Agency. This is HICGI News Agency. The science of imaging has never been so desirable as it is in modern treatment and medical research. Every time that we get accidents, every time that we happen to explore whatever medical condition is, we will need the services of radiologists. What radiologists are doing are capable of finding out what kind of damage probably we could have gotten if you have an accident, or what condition are the organs or even bones. My guest tonight, he is the manager of City Medicals and City Ambulance Group, the president of the Society of Radiography of Uganda, Mr. Muhangi Micah. Welcome to the Senior Citizens Talk.
Thank you very much.
When we talk about radiology, what do we mean? Graphers or radiology? Is it the same or it is different?
These are two different professionals.
Okay.
However, they work together. Yes, the radiologists are medical doctors who have specialized in the field of radiology, and the radiographers are the health professionals who have gone straight to do the course of imaging and radiology.
Okay.
So they are two different careers, but they work together as a team.
They work together
as a team.
Wow, that is great.
Yeah.
Should we also get to know what could be the image modalities that you professionals are able to tackle?
Basically, we tackle every modality as radiographers. So we work together as a team. That's what I was trying to say, that the radiologists come in here and there so that we work together. Because to be a complete team, just like you're going to have a doctor, you're not going to fail to have a nurse.
Exactly.
So the nurse has their particular roles they do, the doctor will do their part. So now that's the same thing with the radiologist. That the radiologist is also going to do their role, and then the radiographer will do their role. I'll give a case in point. We have a procedure. Now that we're talking about kidneys, we have a procedure called nephrostomy. Nephrostomy is a procedure whereby we invasively enter to put a tube into the kidney to aid relief. But that procedure is done by a radiologist. The radiologist is like the doctor, but helped by the radiographer and then the radiology nurse. So there's those things they will do together. Now let's say that procedure, but then there are also other procedures where I will not need maybe there to work together. Let's say we have gotten a scan of the kidney, maybe for screening, maybe for diagnosis. I may not need their help. But we might go to another section and then maybe their help is also needed. So it's working in a team, sharing knowledge, because now they also bring in the special aspect that they are medical doctors, and then they came into the imaging field. So they have that other knowledge they are bringing on board on top of our own knowledge, because now for us we specialize directly from when we start. We start with the imaging, we start with the body. And then become the radiographers who do those procedures.
Okay. Could you break down for us, for the lay people, to understand some of these modalities? For instance, what is an X-ray?
So the modalities, I think we can break down. They could be like about 5 or 6. We have, I think we can begin with the basic one, the father of all, which brought what we call radiology. It's what we call an X-ray. An X-ray is what we are having beside us here. This is an X-ray machine.
Oh,
So this is what gave birth to our field. So then we have what we call ultrasound. Ultrasound is X-rays. First of all, it uses ionizing radiation. Ionizing radiation is their electromagnetic waves, but they pass through your body to create an image of what is inside. So this one uses X-rays. So we call it an X-ray machine. Then we have what we call an ultrasound scan. Ultrasound scan does not use ionizing radiation. It doesn't use any X-rays. For it, it uses on the other part ultrasound. So it uses sound waves which are of high frequency. It's to create an image of the body inside there, and then you're able to interpret. So you need someone who has studied these signs for you to know what they're looking at. Otherwise, you look at it, but it doesn't make sense to you. So you just look at it and end up there. And that's why some pathologies are missed by people, because something is just in front of them, but they don't know what it is, so they cannot tell. So they can't interpret that, oh, this is this, what I'm looking at, you understand? So ultrasound is very, very user dependent. It depends on the person who is working on you. If they are good, you're going to get good results. If they're bad, you're going to get bad results. And also, if they're using a bad machine, then you're going to get also bad results. So it's very user dependent.
This is targeting which parts or organs of the body?
Ultrasound, basically, since today we are talking about kidneys, still it can also be used for kidneys, basically for screening, for diagnosis, seeing how it functions, the functionality, and also for monitoring. Let's say you've had a kidney transplant, we use ultrasound to monitor how it's helping you. Otherwise, the kidney can fail, they give you a transplant, and you're not able to monitor you, and then the kidney dies, and definitely you're not going to survive, because it's what is going to filter those excretions.
Global Logistics Limited, your number one customs stealing and forwarding cargo consolidation warehouse company. We do air shipment, worldwide sea shipment, transportation, tax consultation. Lovey Logistics Limited is a competent company specializing in logistics, clearing and forwarding services. We have the necessary skills and resources and partnerships to tackle sizable projects to our clients' satisfaction. We are located at Mganziraza Plaza near the entrance of Katwe, Kampala, Uganda. Call us on +256 779 634 328 or +256 701 784 648, or visit our website glovylogistics.com or write to johnglovy@gmail.com. Glovy Logistics Limited, your number one clearing and forwarding company.
So the kidney is very important. It's an excretory organ that it filters the blood of those waste products. So the kidneys play a very great role, and ultrasound is one of the modalities whereby it doesn't use radiation. It's very safe, and maybe you might have to incur a cost, which is money for the scan, because it's not done for free. Yes. So those are two modalities.
Yes.
I
So
can
the X-ray targets which parts?
The X-ray still in our part of kidneys. It also, we can use it because some people think it's become absolute, like it has become old, it has been taken over by events, but it's still very important. In a way that let's say if you're having challenges with your excretion, like the kidneys are having a problem, let's say they're having in a way that they're not functioning well, we're going to give you a special dye. We're going to inject you with some medicine in your blood, passing through here. It enters your body, goes into your circulation, is filtered by the kidneys. That is where our target is. So once it reaches the kidneys, it's going to go into the ureters. Now that is where X-ray comes in. When you take a picture, when you have not given that dye or that contrast media, we call them contrast media, then we are not going to get anything. You're not going to see anything. you might only see maybe stones because stones appear on X-ray. However, if we give you that dye, it is special in a way that it will help us look at the system of the kidney. So it will bring out that shape of the kidney. Now that's where X-ray comes in. We are looking at now how the kidneys are functioning. So you see how X-ray is now becoming important in evaluation of the kidneys. That procedure is called intravenous pyelography, IVP. So that is a part X-ray plays in the role of assessment of the kidneys and the ureters. The ureters are it's a system basically, just like we can say reproductive system. This is the urinary system. The urinary system begins with the kidneys which filter the blood. After filtering the blood, then it moves through the ureters. So as we are assessing, still we assess that from the kidneys, the ureters, and until we get to the urinary bladder and the urethra.
And the MRI does what?
Now,
What is
those
it?
were two modalities we had done. We did X-rays as first, we did ultrasound as the second. Now the third modality before you go to MRI is called CT scan.
CT scan.
So a CT scan is like an advanced X-ray. So for it, it has many X-rays like in a circle.
Okay.
So it creates a 360 degree of the body, image of the body. X-rays creates a 2D image.
That is advanced, I can see.
No, it's not so advanced. Just basic principles. This creates 2D images, and a CT scan creates 3D images because the X-rays are many. Like they are receiving at very many points. So it's like, that's why it's a dome. You never find a CT scan which is not a big shape, a circle. What makes it to be in a circle? Because it's a CT scan to be in that shape of a circle is because it's going to receive X-rays from around the body to create that 360, to create that volumetric image. So a CT scan involves more radiation than X-ray, but it creates very good images because it does 360 view of the body. Now, from a CT scan, we can go to now an MRI. An MRI is magnetic resonance imaging. And just like the words themselves, they describe the procedure. Magnetic resonance imaging. Magnetic resonance imaging, we are basically using magnets to see inside your body. Magnets. Yes. And that's why they involve a lot of noise. That you're going to hear knock sounds inside that MRI machine. However, for it, since it's using magnets, it doesn't affect you in any way. It doesn't involve radiation. So we call it non-ionizing. So those are 4 procedures. Each of them has advantages and disadvantages. We can also look at the last option, maybe, is the scintigraphy or the nuclide studies. So there is a particular study whereby we give you radioisotopes. We give you compounds which emit radiations, and they are targeted to go to the kidney, and they'll give us information about the functionality.
Is that a nuclear medicine?
That is the nuclear medicine. It's very, it's a very super specialized unit, and in Mulago we have one.
Okay.
And I think at Cancer Institute they're also setting up one. So it involves those radioisotopes are expensive. They also need to be kept very well. They are also regulated a lot, so not very many people utilize that study. So I think that is all we can talk about that. But people utilize it for both treatment and also for diagnosis. So it's very good, and but it's high end and involves a lot of money.
For more than 10 years, Keb International Group has been your #1 partner in tours and travel consultancy. We also do real estate, legal services, ICT services, and much more. Find us on kebinternationalgroup.com or write to us at info@kebinternationalgroup.com. You may also write to us at PO Box 35827 Kampala, Uganda, or visit us on Namaswahi off Entebbe Highway. Call us on +256 200937566 or +256 3948632 or 46. Or you can send us a plus on WhatsApp on +256 Cam International Group, your #1 rail business partner.
Isotopes as not cheap. They are not manufactured here in Uganda. I think they are manufactured in South Africa and Europe and USA. So they are very expensive. So that is a test not everyone will do. However, it gives us very good information on the functionality because that thing will be there and it will show you how the kidney is working. Yes, that is imaging. We have those 5 modalities. However, what I can say the advantages of each of these. If you are to begin with X-ray, X-ray is cheap. However, it's ionizing radiation that it involves those X-rays. So we also there's that disadvantage.
Maybe you could also tell us what is radiation to a layman to understand.
Radiation to a layman, I can tell you that radiation is their waves, their energy we find in our environment. Let's say, for example, the cars, the earth, they're all emitting radiations. The sun, all of them are emitting radiations. However, for us in X-ray, we make sure that we use them better. We have found that a particular section of that energy is useful, and that's the one we try to use here. So those radiations, they interact with the person at a molecular level. They're going to maybe alter the cell structure. So that's why before you do the X-ray, we need to know the indication. We need to know why you want to do it, not for fun, because we're giving you radiation. So we need to know why you want to do it. It's not done just like I feel like I want to do an X-ray and we give it to you. No, it's done with a purpose because we are using radiations. So now those are the radiations. So of course in our environment they are what we call the background radiation. It's there ever, doesn't stop us from having any issues. And that's why I think you cannot live up to 170, just like our forefathers, Abraham and all the rest. We shall end at somewhere. Why? Because these radiations interact with us and you're able, like there's that, I'm not saying that it's going to cut off your ears or reduce your ears, but the way they interact with you at that cellular level, they might alter some cell processes and then you're not able to, maybe you have those effects. Yes.
So you can't cross like 100 years.
You can cross 100 years. There's no problem with that. And radiations are not the ones which kill you.
What kills you?
Age. You'll be old. You'll be old. So it's not the radiations, but it's just my thinking that because of that background radiations from the earth and everything, if we're in the Garden of Eden, maybe we'll not be having any of these issues. But you know, people keep saying this thing that when I take an X-ray, I'm going to reduce my years.
That's why fear entering the X-ray rooms.
When I do this, I've cut off like 2 years from myself. No,
it is not true.
It is not true.
But what are the side effects?
The side effects we can, first of all, the first side effect is radiation burns.
What is that?
That is physical. Like your skin is going to burn. Just like the way someone can burn you with fire, you can also get a radiation burn.
Okay.
How do we know this? America, when they were having a war with Japan, they threw an atomic bomb.
I remember.
The atomic bomb has radiation. Yes. So when it fell, the radiations are the ones where people have those after effects. That these radiations are not regulated, so they passed through people and they destroyed the environment, burning structures causing blisters on the body. So now you see, now those are the dangers of radiation. That's why X-ray and radiations are monitored by the same body which regulates also atomic bombs, because you need to use the radiations in a safe manner. The same body which regulates nuclear reactors is the same body which regulates X-rays, because you need to use them safely. But only that they are going to classify that this one is for medical purposes, this one is for energy purposes, this one is for defense purposes. We have not reached to the defense. Defense is for other countries. For us, we are basically using for two: medical and then energy purposes. Yes.
The power of memories has never been so meaningful than when time passes by. It's only in photography and videography that we can be able to tell what exactly happened in our lives. Do not lose the beautiful events of your life, from graduation to birthday parties, introduction ceremonies, parties that matter, wedding. All this and much more can be brought down into memories of photography and videography. At KEB International Group, we understand what it means to keep these memories. We are inviting you today to contact us for the best rates in town for your photography and videography events. +256 702 13 75 66 or +256 773 13 75 66. We will cover and reach you at any time, any part of the world. No matter the time, we are here to keep your memories alive. Okay, videography and photography, your number one events memories.
When you talk about it was going to get into my mind recently when there was a Fukushima nuclear plant leak, and the water said they were contaminated. What exactly, which substances or components are they manufactured in labs that cause those radiations in nuclear? Why all they are naturally observed? What is the science there?
Yes. Now that is why I said some are they are natural occurring. You can't create something which is not there. They are naturally occurring and they occur as background radiation. However, when you start purifying them, when you start making them to be in a pure state, then now the radiations are going to increase. They're not going to be like the background radiations where you receive and you not even feel. Now you're going to start feeling them because they're in great quantities and they're in one place. So that is what happens.
Oh, so these
So they are naturally occurring. Even from the sun, we receive radiations as cosmic rays. Those are still background radiation.
That's still
And
background.
they don't affect you as a person.
Okay, let's come to urinary tract imaging. What is that?
So urinary tract imaging is basically the science of utilizing these technologies to image inside the body, especially dealing with the urinary tract. And the urinary tract, as I've described, is one involving the kidneys, the ureters, the urinary bladder, and the urethra. All of us have them, whether you're a woman or a man. It does not matter. You must have those four for you to live: kidneys, ureters, bladder, and then the urethra.
What is their role?
Their roles: the kidneys filter the blood. So once blood comes to the kidneys, it's filtered.
Is it different from the liver functions?
Yes, it's different from the liver function.
What does the liver do in comparison to this?
The liver has the most, I think, functions in the body. It has like 212 functions.
212
Those are the ones
functions.
studied from medical school. So I cannot list them all. But since today we are dealing with the excretory system and in specific the kidneys are filtering excretory products from the body. So those excretory products, once they are removed from the body, then they're going to go into the ureters. The ureters are the tubes which connect from the kidneys and take to the bladder. So once the kidneys are filtered, they filter the blood, that forms like urine. In a layman's term, it forms the urine, but we shall call it excrete. Then it passes through the ureters to the urinary bladder. The urinary bladder is the organ which stores the urine. Then once it stores the urine, then the urethra is the one which takes it out through you going to the toilet and you pee. So now that is the whole system, the urinary system. So we can image it by using these different modalities, which I've talked about: X-ray, ultrasound, CT scan, MRI scan, and then the other one, renal scintigraphy, or the nuclear studies or nuclear medicine. Yes.
I get it. And what is the urinary tract itself, if we can try to understand?
The urinary tract is that system I've described. The kidneys, ureter, bladder, and then the urethra.
So imaging in this purpose means what?
Imaging is us utilizing the technologies which are available to create a picture of those organs.
Yes.
Yes.
Okay. And what symptoms would one require imaging the tract?
Okay, if you want to image the urinary bladder, not every time that you must have the symptoms. And that's what causes issues, I think.
Okay.
That someone waits for them to get symptoms, then they come. They wait to start swelling the whole body, then they come. That, oh, this must be the kidneys. So you don't need to wait for symptoms for you to come. However, when the symptoms come, please again don't stop there and you stay at home. Come and we look at it. So we can do screening for yourself. Like you want to just know the status of your health, of which you can do some tests. You can do analysis, a test of urine. Still, it also gives us, because urine is formed by the kidneys, so basically it will be giving us information about the kidneys. You can also do blood tests, for example, the glomerular filtration rate. That is also still going to give us information about how the kidneys are working. Then you can do renal function tests, how the kidneys still are working. If there's damage, it will still tell us those hormones. Those that you discussed in your previous sessions.
Yes.
Now the rest, this other one in my department is imaging. So imaging, you can come, do a scan, and they tell you how your kidneys are. You can come, do an X-ray, but that one they will have to be requested by a doctor.
It is the doctor to request
for the X-ray, for the scan. Even you yourself, you can go and you're like, today I want to look at my kidneys, because it doesn't involve radiation. Okay, so you can request for yourself for that scan, ultrasound scan, and it will be done by a specialist, either a radiographer or a radiologist. Yes.
Okay. And what could be the steps the healthcare professional takes before ordering these imaging tests?
So before they do these imaging tests, they will look at your symptoms and they know maybe what should I do first, because we have to justify why are we doing this test of the kidneys. So in particular, if someone is having, let's say, swelling of the legs, swelling of the feet, swelling of the facial structures, the doctor may order for a scan of the kidneys to see how they are, the anatomy. But also they might order for other tests depending on how severe you are. So they might want, okay, maybe you've had an accident and they will request for a scan, an ultrasound scan. Or let's say you might have pain especially in the flank areas, these regions here. That's where most of the kidney pain is, either here or in the back, because they are located in the back here. So they are not easily damaged, especially in trauma cases. But if you have the pains around here, and then maybe they have done a scan, and the scan has revealed, okay, this person has hydronephrosis, or the kidneys are filtering urine, but not all the urine is going out. So we need to understand why it did not going out. They'll order for an X-ray. That exam which I talked about, the IVP. So we shall give you some medicine into your vessels to go into the circulation, be filtered by the kidneys. Then we take X-ray images of that and how that dye or contrast agent is being filtered. If there is any blockage, we shall see it. That at that point it will stop. If there is any kinking, like the ureter forming, like let's say a kink, it will still outline it, because that dye will be following the ureter and also the kidney structure. So now there they will ask you for an X-ray.
Of all the strength that your sweat goes, in every single moment that you wake up early in the morning, go to sleep, bed late, you want to have a beautiful home. Acquiring a beautiful home makes your dreams come true. We at Cape International Group are proud to extend our deepest in strength, expertise and team to make your home beautiful. We do stone building and carving on all the nature of buildings that you would like to hold. Stones make a home so beautiful that you cannot underestimate the beauty of stones. From every perfect stone, every carve and every crafting, we do and we achieve this. At Cape International Group, we don't only do that, we also paint your homes. Every nature of paint that you would love to make your home beautiful is available at Cape International Group. A well-dedicated team is here to make it happen for you. Contact us today so we can make your home the most beautiful and secure of all at friendly prices. That is what we are promising you, with a lot of dedication and sincerity, honesty, and every category that you want to achieve. This is what we are talking about. Cape International Group, your number one partner to make a beautiful home for you, with great services of painting and stone. This is what we are. Call us today on +256 773 1375 66.
How you're upgrading. So they have not asked for an X-ray, they have asked for a scan first, then X-ray, and then ultrasound is cheap. I think majority of our places, within 100 meters, you might have like a scan. You have a scan, but not everyone can afford an X-ray. So X-rays are more, let's say, rare than ultrasound scans. But again, if you are having all those symptoms and they are not yet conclusive, they might say, okay, let's go and do a CT scan. Why? Because a CT scan, despite it having radiations, it's more important for you to see inside your body and we diagnose you and we know what is right and we treat it, than you being there scared of radiation, because they are not going to kill you. You understand? They are not going to kill you, but they're going to help us manage you, and then you live a better life. So now the order for a CT scan. That CT scan will image or will visualize inside your body and give us a true picture of how those vessels are. So now there the doctor will be able to know, okay, there's this problem, now I can manage it like this. Then we can also do an MRI. Some people say, no, CT scan has a lot of radiations, I fear what. They'll tell you, okay, can you do an MRI? But MRIs, as I told you, it also has those noises. For it might not have radiations, but it has that noise, the knock noises. So if you're also fearing noises because you'll be put in a room and then those noises are there, then it takes time. So not everyone will be able to do it. However, for it, it's more expensive than a CT scan.
It is more expensive.
We also look at in terms of price to guide us.
True.
So an ultrasound scan, why we begin with it, it's cheap. It's the basic and it's cheap. Then we go to X-ray. It's more affordable. However, not less than an ultrasound. So an ultrasound can be, let's say, 20,000, 30, 50, depending on where you are. An X-ray will still be start from around 30, 40, 50, like that. But a CT scan will be like at 120 in government facilities and about 200 in private facilities. So prices still guiding us because we don't want you to spend all the money in these people who are imaging. Then an MRI, the cheapest you'll get will be around 400. So you see how prices are going high. Now when we go to nuclear medicine, just the radioisotope itself costs 1 point something. So the tests, remember they are going to bring it, so the test is going to be over 2M. So that's how the price is also guiding us. So you can't send someone because you want to know something about the kidney and then you send them for a nuclear medicine test. It's not going to be proper. You have a lot to explain. So depending on how you're presenting, we are able to send you appropriately for the exam. And then the radiographer who is there will do that exam, or the radiologist who is there will do that exam and send back results to the doctor who has sent you that, you know what, you've asked to know about this and this, and this is what I've found. Then the doctor is able to manage you. Yes.
Wow. And what happens after the imaging test?
So after the imaging test, of course, you'll be well, you'll be okay. All these modalities, by the way, none of them is going to cause you side effect because we have tried to do the science and know that for this particular imaging, we need to do this, we need to do that. So there are protocols that we have established that if you want to look at the kidneys and you're doing ultrasound, you'll do this and this. If you want to do an X-ray of the kidneys, you'll do this and this. So after that, I think the rest were taken care of. If you want to do a CT of the kidneys, you're going to have kidney function tests because we don't want someone who put on new medicine and then you collapse. Maybe you are sensitive to that contrast agent. So we don't want to put you through that procedure if you're going to react to that contrast. So we make you do kidney function tests. Then once you come, then there we are able to tell you that these results are good, we can do the procedure so you not react to the contrast. But if your results are bad, then we might not be able to do because we might give you collapse in the room when we have just injected the contrast and you die on the bed, which we didn't want to because we are trying to help you, not to kill you. Yes.
But the doctors spend they don't want to spend a lot of time in those rooms, radiation rooms. They want to put you there, they move out. What is the fear? If it is a safe place.
It is a safe place. That's why we build the walls which are thick and everything. However, the doctor nears the person will come and image many people. Let's say I'm doing X-ray or CT scan. Why we move away is because we are going to work on many people. So if we stay there, we are taking a dose of each of those people. So just imagine I've worked on, let's say, 20 people. I've taken 20 doses. Each of the patients has taken one. So me, I've accumulated 20. So if I stay there, I've accumulated doses for 20. You have taken one, you've gone away. You might not repeat this test in like years. I'm doing it on a daily because it's what I am specialized in. So that's why these professionals, the doctors and also those sales workers, the radiographers, are not going to stay with you in that room.
Welcome. My name is Omuka Francis from JHL Productions Uganda Limited, the makers of the iced espresso, ready to drink coffee. This is purely a Ugandan coffee, starting from the seeds to the packaging to the production, all Ugandan products. Well, at the moment we have it in two. One that is sweet having sugar in it, cane sugar. That's why we call it the sweet original. The second is the original without sugar. This coffee has no additives, no preservatives, and has a shelf life of up to 18 months. We pack it in cartons of 12, having 12 sachets inside the box. The same for the sweet one, the 12 inside the box. So our coffee is purely Uganda. Serving it, you can have it both cold or hot. You can have your coffee the way you want it. For this time, let me make a demo of the hot coffee. I'll take the sweet original, pour it in a cup. It's purely coffee and expressed coffee. Add hot water. And there you go. Your coffee is ready for serving. This coffee can be got at any of the supermarkets around the Mega. We have it at Platia, that's at Kololo. We also have it at Legume, that's after the American Embassy in Zambia. You can get our coffee there. It's purely Ugandan product. It's ready to drink, no additives, no preservatives, and it has a shelf life of up to 18 months. You can get it both in the one with sweet, that is the sweet, and the original, having sugar, no sugar. So meaning you all got the coffee you need. We have a sales number. In case you want to get in touch with us, call this number 0766 530 248. We'll be able to receive your calls. It's both on WhatsApp. We shall be able to serve you. Thank you. Thank you so much.
They should not also fear that, oh, they have left me in the room and they have gone to hide. No, you shouldn't fear. For you, it's going to be a one-time thing. Me, it's a daily thing. I have to work on all those people. So I can't take their doses. But however, we also have monitoring for us, that we check how much doses we have taken after every 3 months. So there we are able to know that you've taken a lot, rest. If you have taken an non-okay dose, they're like, okay, fine. So it's not going to kill us. That's why for us who know more about this, we don't fear the radiations. We know that we are utilizing them for the good, which is to see inside your body and interpret what's going on. Is it a problem? Can we do something about it? And then we give that report to the doctor, who is able to treat you and manage you. Yes.
But could there be any kidney damaging during this time of imaging?
No, there might not be any kidney damage during this time of imaging. Why? Because we first make you do those tests, as I've told you. Ultrasound is safe. MRI is safe, doesn't have radiations. But CT, where we give you contrast, and also for MRI, where we might also give you contrast, we first make you do kidney function tests. Those tests which show us how is your kidney working, because we don't want to give you and then you collapse on the bed or you die in that room. So we are not going to give you unless we are sensitive, that we are sure that this, when we give you this medicine, your kidneys work well, they'll excrete it out. Because this medicine works by going to the kidney. Let's say you have a tumor. We are not going to just do a plain ultrasound and get the whole tumor very well. But we might get it in CT. And CT, we're going to want to differentiate. This tumor here, is it cancerous? Is it benign? So we are going to add contrast agent or that media. So we are going to make you do that test. So that health worker or that radiographer or radiologist will send you to go do that test before you come. So when you go do that test and you bring back the results, they'll look at them and they'll know, okay, these kidneys can filter this contrast agent out. So once we give you that contrast agent, if that mass or tumor, I'm saying tumor because it can be benign, not causing cancer, and then can be cancerous when it has cancer cells. So once you give that dye, those cancerous cells, they have high appetite. They take a lot of blood. So they'll take a lot of that contrast, which you have given you because they're taking a lot of blood. And remember, this contrast you've given, you put it in blood. So it will absorb more of the contrast, and we shall know, according to this absorption, this is a cancerous tumor. This man should be sent to Cancer Institute. So we shall send you there. You understand? Then if it doesn't absorb a lot and it's just there, then we shall know this is a benign mass. This one can be handled by any other surgeon. So they can remove it or they can do appropriate management by that health worker or doctor or surgeon who are called the urologists. They're the ones who do that, or those people who deal with the kidneys. So now that is how we know that this test won't damage you, won't hurt you. So we shall do those checks. There are those checks and balances before you do that test. Especially if it involves going inside.
Yes. I've seen people sitting long time in queues or waiting areas, waiting for results. But what's the exact, or how soon will the results be available?
For ultrasound, the results are usually immediate. If you go to a facility and they have no person, okay, they don't have the waiting line, your results will be with you just immediately. After the scan, they just go type. That will be within 5 minutes, you'll be having the report. However, when you go to a facility where they have many people, then the results might take longer because they will have to work on you. Then they will go make a report. Then they have also other people to work on. So results will delay a bit. But 10 minutes, you have your results after doing that test. For CT scans, once we do them, the radiologist is the one to report. So the results will delay. Usually about a day, you'll have them. MRI, still the same case. The results will also delay by like a day because they have to be reported by the other person called the radiologist.
I understand. And what could be the clinical trials for urinary tract imaging?
So the clinical trials, that's why us as medical professionals, we have clinical trials because we want to improve on the knowledge we had yesterday. We don't want things to stay the same. We want to improve, and new procedures are being developed to become safer or to develop new knowledge. So we shall always do these research trials elsewhere in the world or even here in Uganda, some are ongoing, to make sure that these procedures are safer, or we develop newer methods of seeing inside the body. And that's how nuclear medicine came about, that it can also do that. This was through research. But if we don't add to research, then we're not adding new knowledge to the one we already have. We shall be like that. But we need to advance into the future. And where we are going in the future, we need to do those research trials. For example, we would wish that you don't need to come to the hospital to do the scan for the kidneys. We would wish maybe we put on your machine, you just put around that area of the kidneys, and it just visualizes them, gives you all the information on your phone. So they have to be those trials, clinical trials and research. to help us get new knowledge and how we can image the kidneys better and in a safer way.
Glovey Logistics Limited, your number one custom stealing and forwarding cargo consolidation warehouse company. We do air shipment, worldwide sea shipment, transportation, tax consultation. Glovey Logistics Limited is a competent company specializing in logistics, scaling and forwarding services. We have the necessary skills and resources and partnerships to tackle sizable projects to our clients' satisfaction. We are located at Mganzaraza Plaza near the entrance of Katwe, Kampala, Uganda. Call us on +256 779 634 328 or +256 701 784 648 or visit our website glovylogistics.com or write to johnglovey@gmail.com. Glovey Logistics Limited, your number one clearing and forwarding company.
After the short commercial break, we are still on HICGI News Agents, where every month I will bring you at least a medical practitioner to look at health matters, because health really is important for our lives. We may discuss politics, we may discuss a lot of things, but at the end of the day, our life and health really matter. That's why we invite those professionals to come share with us the knowledge that they went through, that they have. They have a lot, so that we need to utilize. Mr. Muhangi, well, what is a terminology called biopsy in your study?
So maybe thank you for the opportunity. But some patients might be asked to do a biopsy and they might not understand what the biopsy is. So a biopsy involves picking a sample from that body part which they have asked you to do. So if they ask you for a biopsy of the kidney, then they want you to pick a sample from the kidney and give it to them so that they look at it in the lab by specialists called histopathologists, or those pathology specialists. So for them, since they're not going to go inside, they will ask the imaging personnel, either the radiologist or the radiographer, to go inside and pick a sample. So by the time they ask you for that test, your doctor asks you for that test. That means you have maybe a mass, a tumor, something where they can pick from that is suspicious. So they're going to pick a sample, then that sample will be analyzed in the lab. That test is invasive because it involves going into the body and picking that sample. So there may be bleeding, which bleeding might be uncontrolled, and that's why we have those radiologists who control the bleeding, do what is appropriate for the exam. And we shall also have the team, let's say radiology nurse. So those tests also don't come cheap. They come at a cost, at least, which is significant, more than the normal rates which you usually do, because they're going into the body and we need to be sure of your health. So we need to make sure as we do this procedure, it is safe. Yes. So that's what we call a biopsy.
Is it something that cancer patients are asked to do?
Yes, they can also be asked to do that, but not every cancer patient will require a
suspected
biopsy.
Patients.
The thing is like steps. Not everyone is asked. By the time you're asked, that means they need it. If you're not asked, like we can go back to where we went, they can ask for the CT scan, which is contrasted, to see whether the mass is cancerous or benign. Does it take up a lot of that contrast, or it doesn't take up a lot? So that is also showing us that, okay, this mass is cancerous, or this one is not cancerous, it's benign. So this one of biopsy is just coming to give us that surety that this mass is definitely a cancerous mass, or this mass is with certain, maybe it's a 99 point something, it is a benign mass. So now that is going to give the doctor a picture that, okay, I can do this or I can do this. Either I operate Oh, no, let's first manage from Uganda Cancer Institute or from a cancer center, because it's not only Uganda Cancer Institute which manages cancer cases. There are a lot of other organizations there. So that's what we call a biopsy. By the time you ask for it, then you know it's sensitive, and they are looking at that mass, getting a sample from it, what our people usually call akanyama in Uganda.
Yes.
So they pick that sample and then they take it to lab, which lab will look at the cells and know the composition. So they will tell us that this mass is a cancerous mass of the kidney, and then this, and this. Then the doctor is able to manage. And that's how medicine is. For us, we don't treat the symptoms, because if we treat your symptoms, you're going to come back because we have not treated the root cause. But if we work on the root cause, and that's why imaging is important, if we work on the root cause, then you're not going to present with the symptoms. You understand? Yes, so that's how imaging is very important, that we shall be wanting to get the root cause of the problem so that you work on it and you don't present back with the same issue. Yes.
I've interacted with someone where they had to drill into her bones to, I think, get a word for a cancer test. What was that kind of? And he said it was so painful when you were drilling into the bone.
Now, those are part of biopsy still. But biopsy can be bone marrow biopsy, can be, because now you can have cancer of the bones. They'll need to drill into that part of the bone and get a sample from it. That is painful. But now we are dealing, since we are on the topic of urinary tract, we shall do a biopsy of the kidneys to find maybe if there is that mass. They'll pick a sample from it, and then that will be it. So those tests are invasive, and that's why you see he felt pain. It's not that you'll be there and maybe you're doing a scan, no issues. There is pain involved because they are trying to enter the body and get that part, get that sample. So it's painful, and maybe they might give you some analgesics, maybe anesthesia to help, but still you feel some pain.
In those medical investigation is repair to wind up with the meat. At what level and what could be the repercussions when they decide to pick water from your backbone?
When they are picking water from the backbone, it is majorly for two things. Okay, this is not part of radiology, but it's majorly for two reasons. One, you might have infections in the brain, and we want to study why are you having that infection. So we shall pick from the spinal cord, because the brain, that water resolves in the brain and goes to the spine and then comes back like that. It's a cycle. So once we pick from the spine, then we're able to detect. Maybe we go and analyze that sample. The second reason one would pick water from the spine is to relieve pressure from the brain. So if we are picking some water, we are reducing the pressure because we are reducing the quantity. Maybe it's a lot. So that is the second reason. So one is to study if there are infections by looking at the sample. The other is for treatment, alleviating the pressure from the brain by removing some of the water. So not everyone gets that test, but it's not radiological. For us in radiology, we have what we call myelography, where we inject special contrast into the spinal cord to also evaluate that spinal cord. Yes.
But I was told, is it true, that when you pick water samples from that spinal cord, that chances of someone surviving are very, very minimal, but most people die?
No, that's not right. That's not true. And that's why I've told you that they do it for two reasons. One is for treatment, that they are reducing the water, so they're reducing the pressure in the brain. Two is to analyze that sample, and they should also not be true that once they remove that water, and you have backache, that should be the reason. That they gave me that they removed that injection they put in my spine. It's not the cause. But we as human beings have that relationship. We associate things. That because they did this, it must be the reason why I'm feeling the backache. Even me as a normal person, I can feel the backache even when I didn't have that procedure. So we need to just investigate the cause of that. It's a backache. And that's why imaging plays a very big role for diagnosis. Why are you having that backache? You may be doing an x-ray, you may be doing maybe an MRI, maybe a CT scan, just of the spine to look at what is causing the backache. So it's not true that once they do a procedure, you don't live long. You live even more than even me, who is very normal and I've never done that procedure. Most of these procedures we've never heard about them, we've never done them. But not all of us are going to make it to 80. Not all of us are going to be 100. So it doesn't reduce the number of years. Basically, we're trying to help you live better. We're trying to manage you. But it starts from the other part, that we need to know the cause, so that through imaging, so that they may manage you by the doctor the other side when they know what is causing that issue. Otherwise, if you treat symptoms, that same thing will reoccur. So if they give you medication, let's say for something that is not causing those symptoms, the symptoms will go because they have given you medicine for that. But they'll come back because what is causing them is not what has been managed. That's where imaging is coming in, because we are visualizing inside the body, we are looking at those structures, we are able to tell that this structure has a problem. This part has an issue, and this is the issue. Either an infection, maybe either a mass, maybe some stones are stuck there. So we are able to help the doctor the other side manage you better. Yes.
As we wind up, what are these myths in regards to this
So I think the commonest myth which I find, and this is among men, is they never come to the hospital because they think scan is for pregnant women. Why should I come and do a scan? Why should I come and do an ultrasound scan? So scans are not for only pregnant ladies. The scans for pregnant ladies are there. That is true. For your case, you're not pregnant. You also have your scan, which is tailored for you. Let's say for today, for kidneys, you want to look at the kidneys. Do they have a problem? Are they okay? You might have kidney stones and you're there at home. You might have other pathologies, maybe infections, and every time you get backache, they're giving you just muscle relaxants for the back. You're not treating the root cause of the problem, which is the kidneys. And if you have maybe done a scan, then you would have known and treated that infection in the kidneys, which we call pyelonephritis. I don't want to bring these big terms, but when you treat that infection in the kidneys, then the back will stop hurting you. But you're going to get wrong medication because of your myth that scan is for pregnant ladies. Me, I don't need it. It is the back disturbing me. And you insist with your healthcare provider or your doctor or your clinical officer. And for you, you're saying, me, I don't want, me, it is the back. Why are you sending me to do scan? So that is one of the commonest myths I find that is affecting people. Another myth maybe I can talk about is someone who is swollen the body, it's only the kidneys. It's not true. Not only the kidneys that cause swelling of the body, there are also other organs. Even the liver can cause it to swell. However, if we have not done imaging, we shall not know. And how our medicine works is we have to know, then we treat that thing which is causing. So not everyone who has swollen and then everything, then the kidneys are the problem. No. It can be the liver, it can be also other causes. Maybe the heart, maybe the vessels. There's so many causes. So not every person, however, a great number of them, it's because of the kidneys, but not every person. Then the third myth which I can talk about is when you tell someone that you have an infection in the kidneys, or what we call pyelonephritis, or glomerulonephritis, or nephrotic syndrome, they may think this problem cannot be treated. No, it's not that it cannot be treated. This just like any other body part, it can get an infection, which infection can be treated with medicine, tablet or injection, depending. So when someone tells you, oh, I have infection of the kidneys, you go cut down the chickens, you start selling land, after all, I'm going to die. After 3 days, when they've given you medicine, you're okay, you've sold all your property. And you're very alive. So you see you have problems. So kidneys can get infection just like any other body part. Just like you can tell you have an infection in this region, the kidneys can also have an infection. So it's just important that you come, these doctors or the health workers, look at your image or do those procedures. They find out the cause of the problem, and then we're able to manage. And then you'll be back to normal life in a week or days, depending on the condition. So the other misconception is myth. People always want to come when, actually, I think it's what has been causing most people to say, when you suffer a problem with the kidneys, you are dead. It's because people come, by the time they come to see the doctors, by the time they come to do imaging of the kidneys, their conditions have deteriorated. Don't wait for that time. That's why we are saying they are screening tests. You yourself, you can walk in a hospital, request for an ultrasound of the kidneys. They will look at the kidneys, they'll tell you if they're normal or not normal. You don't have to be sick. But now when you wait, you're sick. Now, kidney disease, how it works is in a cascade. Cascade that it works in steps. Once it fails, from there it will fail more. Then start failing more. So once now they start deteriorating, and then for you come in bad condition, when they can't even do anything about some of those conditions, because we have through research discovered that some conditions we might not be able to maybe kidney damage, maybe kidney failure, just like the word failure, we're not able to manage it. Like to revive your kidneys, you have to be assisted maybe by dialysis or these other conditions. And of course, on imaging, someone or even on ultrasound, they'll be able to tell you that your kidneys are having issues. And then they will forward you to the doctor. You go to the doctor because you came late that the kidneys have failed. So most people tend to assume that when you get a problem with the kidneys, it cannot be worked upon. However, this can be solved by you coming early. When you come early, they can look at the kidneys. We can know that they have either a problem or not having a problem, and you walk away. If they have a problem, they will give you some medication and you'll be fine. So when you get some of these things early, you are able to manage early. But the problem which kills most people is they come late. You come late. And once you come late, the numbers which are going to die, they will always increase.
The power of memories has never been so meaningful than when time passes by. It's only in photography and videography that we can be able to tell what exactly happened in our lives. Do not lose the beautiful events of your life, from graduation to birthday parties, introduction ceremonies, parties that matter, wedding. All this and much more can be brought down into memories of photography and videography. At KEB International Group, we understand what it means to keep these memories. We're inviting you today to contact us for the best rates in town for your photography and videography events. +256 702 13 75 66 or +256 773 1375 66. We will cover and reach you at any time, any part of the world. No matter the time, we are here to keep your memories alive. Okay. Videography and photography, your number one events memories.
We cannot do much. We could have done better when the disease was starting. And most of these diseases are manageable, they are treatable. But because you're coming late, by the time we image, we are seeing that, by the time we do these tests, we are seeing that your kidneys are already failing or they're in that state. So that's why we need to really image these kidneys. And then maybe another important thing I can say before we close this show is hypertension or high blood pressure does not only happen to those people who are very old, because most people may be there and they're like, oh, my God, like, how can I have hypertension when I'm 15 years old or when I'm 12 years old? It does not only affect people who are very old, our fathers, our grandmothers, our grandparents, or our mothers in 50s, 40s. Even you, a person in your 20s, you can get hypertension. And hypertension is going to come from the kidneys. It's important we evaluate them. If you have hypertension, if you maybe you're going for a checkup and you find, okay, your blood pressures are up, you're 20 years old, the commonest cause is going to be due to the kidneys, and they are going to send you for a kidney test, which we're going to do either ultrasound or looking at the kidneys or the vessels which come to the kidneys, which we call renal Doppler ultrasound, looking at the vessels in particular. So those are some of the things that are going to cause hypertension in young children, not only old people, because people might think, no, hypertension is only for people who are very old. And I think that is something important we can take from this. Wow. That once you are maybe a young person and you're diagnosed with hypertension, you need to know that, yes, you're going to be asked to do some of these tests. We understand why you're out of the normal. Why are you having that hypertension, that high blood pressure when you're still a young person? Yet it usually occurs in a certain group of individuals, which are the people who are elderly in age or older person. Let's say 40 plus. So you of 20, why? So we need to image, see, and also diagnose.
Wow. Is there anything else, Your Excellency, the President of the Radiography Association, would like to say on our show's wind up?
Just that we need to improve our health lifestyle, try to exercise more, try to do some of these screening tests. If you have opportunity to do a checkup, go and do it.
How often should we be doing checkups?
I wouldn't say that you should do it very often, but once in a while.
After 6 months, or
you can even do it after 3 years or 5 years.
okay.
The kidneys are not going to be bad in that period. But have those checks. If you have an opportunity, because there are some people who have done these checks, I'll give you a case in point. There are people who come for full body checkup. And in one way or the other, you find, oh, this body part is having an issue. And then you're able to help them appropriately. I would mention some names, but since we have that oath, we might not go into the particulars of those people. But some of them have become that wise. And that's why we advise some people that don't wait for the time to be when you are badly off. Just come when it's early and they will help you. The medical professionals, after them screening you, they will know that, oh, you're okay or you're not okay.
Or someone in a general hospital, not relatively expensive, how much can it require to do a full body checkup?
Full body checkup, depending, because most of our government facilities are free of charge. So you're going to do a scan. If you go to any regional referral, it's free of charge. That one at least I've visited most of them. If you decide to come here and you have your money, our ultrasound scan is 60,000 to look at the kidney you also decide to go private, any other private facility, if prices will vary between 20,000 and 100,000 for an ultrasound scan, which is the basic. It doesn't have radiations, and it's used for screening just. You don't have to wait for that time. Yes.
Wow. It's been a pleasure to host you, Your Excellency, Mr. Muhangi Micah, on the Senior Citizens Talk of HICGI News Agency. Our viewers from Nicaragua, Cambodia, Venezuela, Brazil, in Canada, United States, Russia, China, Japan, Australia. It's been me, Kivumbi, Earnest. Benjamin recently have been awarded an honorary doctorate from the Canadian-based University in Humanities to appreciate some of what I'm doing in this show at Humanities. On the camera has been Faith Barbara Ruhinda and also Moses Kivumbi. Until next time, my name is Kivumbi Earnest.
Welcome to Princess Branding Services. Do you have a party, introduction, or you have lost a loved one and you intend to do burial or branding? At Princess Branding Services, they do branding for baby shower, political rallies, and all kinds of celebrations and functions. Contact us for great and friendly, affordable prices. We will brand your t-shirts, capes, bottles, umbrellas, photos, bags, frames, and much more. Contact us on the number on your screen. +256 783 20 95 79 or +256 744 580326. Email princessbranding256@gmail.com. The Senior Citizens Talk is brought to you by Africa at Heart, Heal the Planet Global Organization, HICGI News Agency. Subscribe right now to get our latest updates sent you every single Sunday. Don't forget also the Talk to the World show that is running every Thursday at 4 p.m. Subscribe here on YouTube and make your notification bell right here. HICGI News Agency. Visit us on HICGINewsagency.com and find us on all social media platforms on X, call it Twitter, on TikTok, Instagram, and Facebook. HICGI News Agency. Subscribe now.